I thought about making a joke and having a huge pile of papers. Welcome. I'm so honored to be here today and speak to you guys and talk about the profession and FSOMA. You know, you're starting a new chapter. It's not the end, it's a beginning. And you're going to be acupuncture physicians and now be stewards for your medicine. So take a moment and let it sink in. You are now part of a lineage of healers that goes back centuries. You see the person, the whole person, not just a symptom. You listen deeply, treat gently, and work with the body's innate wisdom to bring balance and restoration. That's a no small thing in this world. Right now, the world needs what we have to offer, and I am a licensed acupuncture physician, so I just want to point that out. Not all executive directors are, so I've been where you are and know what it's like. So people are searching for meaning, for connection, and for healing that doesn't just mask symptoms. They want something that gets to the heart of the matter, and that's where we thrive. As acupuncture physicians, you have the tools to help them find healing with your hands, your minds, and your hearts. You know, this is both ancient and modern. Our medicine is the most oldest continuously practiced system of medicine in the world. And it's both ancient and modern. We have new challenges in the 21st century. Autoimmune, the toxic environment we live in, anxiety, both physical trauma and emotional trauma. Just watching the news brings emotional trauma. So we've got a lot that we can help with. We hold space for patients in this fast-paced, impersonal healthcare system, which has turned patients into products on an assembly line to get through the office. We don't do that. We offer something rare. We offer presence, intention, and individualized care for the whole person, not just a part. Your education at Dragon Rises has given you a deep and nuanced understanding of Eastern medicine. Stepping into practice can still feel a little overwhelming. You're starting a new chapter, a new adventure. You might have questions about licensing, starting a business, finding mentorship, or a job, handling difficult cases, or just figuring out where you belong in the larger healthcare landscape. And this is where FSOMA comes in. FSOMA is the Florida State Oriental Medical Association. We are a 501c6 nonprofit professional association for you. We are your professional home, can be your community and your support system. We advocate for you at the state level to protect your scope of practice and ensure that acupuncture continues to be recognized, respected, and integrated. We offer continuing education that doesn't just meet the requirements, it inspires you to grow as a clinician. We create opportunities to connect with other practitioners, with the wider AOM community like herb suppliers and needle manufacturers, and to connect with community in the state as well as nationally. One example I want to tell you about what we can do is we had a member call us, and he was trying to build out a practice, and the city was telling him he was a medical practice and had to have some really expensive electrical wiring done in his new office. He didn't like that, and you know, a single acupuncture needle is not a significant piece of medical equipment. So he called us, and one of our board members was able to work with the city and get that waived. So that's one thing we've done for somebody that doesn't necessarily get on the books when you look at our list of what we do. So one of the most powerful things we do is work with the legislature, both to avoid issues and to promote and solve problems. So currently we have a bill before the House. I think it's passed the House actually. We're hoping to get it through the Senate. Sometimes it can be several years before you can get a bill through. I need to explain a little. There are laws and rules that govern our practice, both nationally and in the state. And in the state, the Board of Acupuncture makes rules. But because some things are in our rules, but not our statute, there's been some problems. Insurance won't pay us for evaluation and management codes. If we do an exam, which is required by the Board of Acupuncture on patients, they won't reimburse us for that procedure. The other thing is the difficulty getting acupuncture injection materials for AIT. And that's because it's in rule, not in statute. So those are two things we're trying to solve in the legislature this year. Another problem we're working on is supporting the American Society of Acupuncturists, who are trying to get us into the Social Security Act as providers. A few years ago, Medicare made a rule, this is laws and rules, a rule that MDs, nurse practitioners, and people with this training, and they spelled out our training, could provide acupuncture to Medicare patients. This was the federally managed Medicare program. Because we're not providers in the Social Security system, we can't bill them. We can't see a patient in our office. We have to have an MD in the office who then bills for us. And this is a problem, so we're working on this. A number of people have said, we don't want Medicare, it's gonna change things too much. Well, if we don't get into Medicare, it's gonna change things because other people are gonna step in and they're going to take our place providing acupuncture-like services. I don't know if you've heard the phrase food-like substances for the food that people sometimes eat. Well, they can do acupuncture-like services, and it's not our medicine. It's not the power that we hold. So that's gonna happen one way or another because hospitals wanna hire us, but they can't figure out how to bill. So we're trying to solve that problem nationally. You know, personally, I want to see us start promoting our whole medicine, all the things we can do for people. Acupuncture is just one tool, herbs, qigong, nutritional therapy, tuina. I think there's more I'm probably forgetting. Meditation even. You know, the 3 free therapies for lifestyle. We have super things to offer people of what they can do to help themselves. So, last page, almost done. So there's a lot FSOMA does. We hope you'll join us. But also want to remind you we're here for you. I want to talk to you guys. It's kind of hard not to see you. We're here for you. Whether you open a practice, you know, join a clinic, work in a hospital, contract employee, whatever you end up doing, we've got people that have experience with all of that and we can help. You know, I've had a lot of experience. If I don't know the answer, I know people who can help. So we're here when you need advice, updates on advocacy, clinical inspiration, or just someone to talk to. So as you cross this threshold today, I want you to know that this is a beginning, not an end. Your education was the foundation, and your real journey as a healer starts now. You don't have to do it alone. I know you've got your classmates, I can tell you guys are close, but we are so proud at FSOMA to welcome you to the profession, and we're here to support you, cheer you on, and stand beside you. Congratulations.